All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So I wanted to show you two things today. One is how I made this video yesterday. That is the, what was that video? That was the video about the, what topic was it? See, I worked on it for 2 days and I forgot. When I come in front of camera, I usually forget. So let's review Novavax phase 3. So that video was 7 minutes or something. However, it took me the whole weekend to work on it. It is actually difficult to create a recorded video compared to just doing a live chit chat. The reason for that is that for recorded video, here are the things that I did. I'm just going to see if I can show you some of these things. For example, there is a, I'm going to, so if you see here, I'm gonna share my screen. So you're going to see the raw material of how I work. So first, I went through the document and created this set of notes. And then once I knew that what are the things that I need to do, then I created so this was the basic structure of the talk. So for this structure, what I did was, if you see here, first I created a flow of what were the number of patients, the date of the trial, who were selected, who were screened, who were actually followed up, then what were the groups, then what was the efficacy, what were the moderate to severe deaths, side effects, everything. So I created this. So that was one round. So after creating the notes, I did a structure. Then once I did this, then I started figuring out how do I represent this. And so for that, I did multiple diagrams to figure out how, so this is the raw material you're seeing. How do I represent various concepts? So for example, screening process or randomization process or getting vaccinated versus placebo or gender and various, ethnic groups and so on. So I went over that once more to try to, again, don't judge me on this. So once that was done, then I did one more go on it and kind of made a little more polished structure. And as you can see, that is here. And still the final video had some different structure. And then I created the flow of the lecture. Then once again, I am so sorry. Luffy looked so dangerous because his claws were out. So next videos will. So anyways, then I drew this all. Once I had it, then what I did was I went to Photoshop. Let me bring Photoshop up. So here, this is Photoshop. So here I drew various diagrams and then picked them up from here, and then I brought them into the Adobe Animate. Over there, then I added whatever tiny bit of effects I could, those little confettis that were flying And then finally, I recorded an audio on top of it, cleaned up the audio, compressed the audio. I forgot to speed it up. So my presentations are usually slow. So I forgot to speed it up. So without speeding it up, then I composited the audio with the video, and that is the final result, which then I uploaded. So the final result for 7 minutes, but the work was for 2 days. My question to you is, do you feel that that kind of video? Here is the benefit I saw. The benefit was it was just 7 minutes. I spent 2 days, but eventually when the 7 minutes video is presented, you do not have to spend half an hour or 1 hour. And so imagine if this video is watched 500,000 times or 1,000,000 times. Then for 1,000,000 people or million views, there is a saving of 10 or 15 minutes per view. And so if I spend more time, then I save people's time in bulk. So that is the basic idea. The downside is spending so much time would, of course, slow me down for presentation. Secondly, my arm, I sat like this and I kept drawing, and my arm is now, since last night, it is just hurting so much. So the here is the Moorhouse says, are we the testers? Yes, you are the testers. So please test. So the question that I'm going to ask you is this. Algebra says that was like an information public service announcement. And you may have seen actually that I fluctuated in the artwork because it would depend how tired I was or how much my arm was hurting. But I think if a couple of artists are working on it, so let's say one is doing the inking and the other one is doing the basic designs, and one is the video editor, then all of this part of the work is taken off of me. So my work will become mostly pulling together the information, organizing it. Maybe it is my audio or the audio from other. So I have a beautiful program. It is in its beta. I'm going to show it to you as well. I don't know if they would allow me to use it after the beta or not. Let me show you. You would love it. It's just generally one of my team members sent it to me. Okay, so it's not going to work because the free trial has finished. But if you can look at a software called Replica. Replica allows AI generated audios. So the audio generated by this is not robotic at all. Remember, there are robotic audio or computerized audio producers, and they have I am going here, I am going, right. So this one is actually very natural, and it is acting voices by various characters, and they produce a beautiful voice set. So I was thinking that I produce voice by that if my accent comes in the way, or I hire a voice actor as well. So this is all the story to say, if you like these shorter videos, I'm going to use the support that is being given on Patreon. It is not sufficient yet, but I think if we produce more such content, folks would become more patrons and help produce more of these. So tell me, did you like it? Denise says, oh my God, let me be your voiceover. Absolutely. Just tell me if you would like to. Denise, I would love to. Barbara says, we like your voice, Dr. Bean. Thank you very much. So like, Lizzie says like, Skyfrog says like, what accent? Sounds perfect. Good to me. Thank you, John Snyder. I like your accent. I'm Gregory. Thank you. I'm going to start crying now because, yes, some of those videos, if you can. I have heard from people saying, if I heard one more word from this guy, I'm turning it off, and then they turn it off. Letitia says, just be, yeah, sure. Yes, so Pasi, I was actually reading this news that there is a deepfake AI that can actually replicate your own voice. The problem is, do you want my voice? Because if that is the case, I can speak as well. The question is, if AI is going to replicate my voice with my accent, then it is really another Mubin with the accent. Okay, so Denise, you have to then do it. I would love it. Thank you very much. Siddhartha says, I like your voice too. Thank you very much. So, what I'll do is this. Here's the plan. And here is how I feel about it. When we were growing up and we were studying in medical colleges, in the medical colleges, outside the wards, there used to be plaques that would say, this family or this person donated to build this ward or donated to build this part of the hospital. And their good deed and their donation continued for a long time, even till now. And there is service to humanity that is happening. So, if you like this work, this is not just the pandemic work, this would be the work for healthcare workers, students, medical students, nursing students. And this is sort of a paid forward to have more people. I wish to have these videos compressed and be more spread and serve more. So if you can become part of that, it has to be a very thought out decision on your part, maybe $5 a month or $10, but if you can reliably do that on Patreon, then it would be this would be a great contribution regardless of the pandemic, because as the pandemic is winding down, we would go into other topics of the medical learning, physiology, pathology, pharmacology. And so these topics may not always be what you are looking for, but they would be what medical students and nursing students need. So if you can help with that, that would be awesome. If not, there is no pressure. Because I remember 5 years ago when I started this, I was talking with some investors. Most of the time, I have not gotten investors to invest in this company. And I was talking with an investor and he said, looks good. I'll think about it. And I said to him that you think or not, I am going to do it. And so here I am, 5 years later, I am doing it. And I will continue to do it because I believe this is something easy, accessible medical content is necessary for healthcare education. You may have seen that in healthcare education, we tend to become very wordy in terms of complex words. And many of the literatures are written in a way that they are full of jargon and complex words. And even medical professionals and students find it difficult to capture all that. So I think it should be made easy. So this is my pitch to say, if you would like, join me in this, regardless of what topics are relevant to you. But if you think about it, that there are topics relevant for medical field and for educating healthcare professionals to be able to practice better because they can think better. And unfortunately, in this pandemic, you have seen how much conflict and disagreement in medical professionals is because there is a misunderstanding or misknowing of the fundamental concepts. So this is my um, long-winded question. Now, somebody had said, when are we switching to Odyssey? So I try to do that every day, and I forget how to do it. Meaning, I do not find a way to do this where I can inform you correctly. So for tomorrow, I promise I'm going to try Odyssey, but let's have that plan. What I'll do is this: once I create the Odyssey live chat tomorrow, I'll probably do one regular chat at 6 o'clock, and then before 6 or after 6, I will create the link for Odyssey, share that link on Twitter, plus on this YouTube channel in the community area. So if you go to posts, if you go to channel, then go to community on the channel tab, there will be posts. I'll post a post there with the link to Odyssey, possibly about 6 o'clock, a little before or after. So once you click that link, in theory, you should be able to join the talk. You don't have to be an account holder of Odyssey to become participant in the talk or to be able to be there. I think to comment, you'll have to be an account holder, and then to be able to do a donation or others, you'll have to have a more than account holder. But I think that is something that can come in later. Moorhouse says there is a conflict because it's a novel virus and people have different opinions. We are learning. Absolutely. But there is a bad part of this all. I was not expecting that to happen, but it is happening, and it is happening to me. I think I'm going through this right now. As we are learning, there are folks who are making it their problem to take down anyone who may have a differing opinion. And that is the dangerous thing that is happening. And they are taking down people. For example, they're complaining. I went through those things. They're complaining, they're trying to tear down people, they are trying to threaten people. So that part of the discourse isn't the good one. And it is interesting for me that both sides, I think there are more than two sides, but two major sides, are both attacking each other in the name of protecting the humanity. And so it is sad. Both say, I'm protecting people by attacking this. And so you are very correct, Moorhouse, that this is the normal discourse, and this is the normal disputational dialogue that happens where truth comes out. But nowadays, harm is coming out as well. This is very correct. It is un-American, but it is happening. And this is, Cobbs, this is very correct that regardless of what side, both sides are doing this to each other and to others. And they think they have a right to do it in the name of protecting humanity. So this is where we are at. Let's see now. I'm just going to do a few questions and then stop for today. My arm. So here is the reason why it is becoming so bad. I put my arm here on the table and I sit like this and draw. And so this got a lot of beating in the last 2 days. Grace says it's all about ego. I totally agree. And there are more than, for some it is ego, for some it is money, for some it is liking, disliking of others. So there are multiple factors and they are conflated. This is, I used to say that sometimes people, and this was mostly, and with my due apology, I shouldn't talk about religion, but sometimes I would say about Muslims, some Muslims, that they use religion as a disguise, as a cover to attack others and then just simply justify it that religion said it. I am seeing that kind of behavior where a person's attack may be actually malicious, but it is disguised in, I'm doing it for the protection of someone. Okay, so let's look at a few questions. Here is the question. John says, Pre-symptomatic, asymptomatic, symptomatic. Dr. Bean, could you please explain mechanics behind the three aspects, how they differ, and also how vaccination or natural immunity would impact these mechanisms? And are you comfortable, because most of the chat before these questions were just me making a case to say, let's support and let's do this regardless of what our own topic needs are. Are you comfortable I delete this chit chat afterwards, or should I leave it up? Let me answer some of these questions. I really want to do what I did yesterday, short videos to the point, but I really need to hire a few people to help with that. Okay, so let's see, pre-symptomatic, asymptomatic, symptomatic. So let's start from asymptomatic first. First concept to keep in mind is asymptomatic does not mean the person's immune system did not respond. Or let me back up and say that is not the only one possibility. So for example, let's say in an immunosuppressed person, the virus arrives, their immune system does not respond too much. Now the virus destruction could cause symptoms as well. But imagine if the virus destruction's symptoms are also not felt, maybe they're taking anti-inflammatories and immunosuppressants. So there is a possibility of someone on drugs or with a compromised immune system to have the virus and to be not able to respond to it. And they might even harbor the virus for a longer time. Again, they are patients. It's not their fault. They did not ask for it. It is just the way it is. So the discussion here is not to blame someone, but to understand. So that is one possibility of asymptomatic. The other possibility is somebody's immune system is so up to speed, and that may be because they have reactivity from other coronaviruses. And we saw that study that people who may have human coronavirus infection recently, they may actually respond to SARS-CoV-2 with least amount of symptoms. That is one possibility. Other possibility could be that they had recently, imagine they were vaccinated recently, and their vaccine system has produced enough antibodies that they're present in IgAs are present in the mucous membrane, the IgGs are present in the body tissues and blood, and so they are able to just very quickly handle it. An immune system was in an active state. They may be asymptomatic. The third is, let's say that their immune system just is able to attack right at the beginning, right at the innate arm, very quickly. And then, as you saw, that for example, in children, and this would be possibly for adults as well, that if the ACE2 receptor density is less, then they may not develop enough symptoms. Or we saw that if natural killer cell numbers are more and natural killer cells are active, then they may not develop symptoms. If their supplements, important vitamin D, C, which are part of this is not a quack science. We should have right amounts of vitamin D and E or C. And let's say that we have said that sufficiency level is 30 and above. Who knows that that was the sufficiency level for normal general operations, and maybe for infections the sufficiency level actually should be 50 and above or 40 and above. So maybe those levels need to be recalibrated. They were not sent in they were not set in stone to say this has to be 29. Maybe this need to be recalibrated. So natural killer cells, vitamins. Then we also know that cross reactivity, as I just mentioned before. These all are the possibilities that can cause a person to be asymptomatic. So that means there can be pathological reasons and there can be physiological reasons that a person can be asymptomatic. Now, of course, we know symptomatic means what. So this is asymptomatic. Symptomatic. Symptomatic is a situation where somebody has the symptoms. Normally, what we say is in microbiology and epidemiology is that when a pathogen lands in us, it is infecting us, regardless of what it is doing. If it landed in us, it has infected us. If it causes disease, that means symptoms start appearing. Sorry, if it causes symptoms, then it is called a disease. So that means if SARS-CoV-2 today ends up on my tongue or in my mouth, I am infected by SARS-CoV-2. If it causes enough damage, that damage and inflammatory response starts making me having symptoms, then I have COVID-19. Just having SARS-CoV-2 in my nasopharyngeal area does not mean I have COVID-19. COVID-19 is the disease, SARS-CoV-2 is the pathogen. Presence of the pathogen is infection, pathogen causing destruction, and symptoms is the disease. So here, symptomatic would mean disease process. And so the reason for that is pathogen causing destruction of the cells, so it is breaking down the cells, and then so the tissue destruction. Of course, if you take somebody's lungs and destroy it, let's say there is no immune response, but still you destroy the lungs, do you think that person is going to survive? No. So the tissue damage in itself would cause symptoms, and then inflammatory response causing further damage and causing irritation and generating cytokines that are irritating, that would cause nerve damage, that would cause pain, that would cause irritation of the areas, and so on. So that would be symptomatic. Now, pre-symptomatic. Pre-symptomatic basically means that the person, so let's put it here first. The person will have symptoms, they don't just have them now. Normally, you cannot tell somebody to be pre-symptomatic, because if somebody has the infection here, pathogen landed in their nasopharyngeal area, there is nothing to say that they would develop symptoms or they would not develop symptoms. So that means all infections cannot be called pre-symptomatic, correct? Infection could lead to asymptomatic outcome, or it could lead to symptomatic outcome. If there is a symptomatic outcome to follow, then the infection time was pre-symptomatic. That means it's really a retrospective observation. It cannot be a prospective, because if we make it prospective, we are trying to predict the future in a person, which we cannot. So if I draw it like this here, let's say this is a line, somebody got infected here, then for 2-3 days, they didn't develop any symptoms while virus replicated or increased in number. Then at a threshold point, enough damage and inflammatory response occurred that now symptoms have appeared. Then this area can now be called pre-symptomatic, or this phase. But imagine that virus actually increased, their immune system responded, virus was taken care of, no symptoms ever appeared, then this part cannot be called pre-symptomatic because there are no symptoms. So this is really labeling of this part based on what happens here. So I hope that answers that question. It's a good question. So thank you for your super chat, for your support. However, this question is something that is beyond my expertise. I would prefer, so now this is a position that I put out always, and this is a position that gets me hammered all the time as well. I am a pro-vaccine person. I took vaccine for myself, for my family. We are now even discussing boosters. For example, my wife had Johnson & Johnson. Johnson & Johnson has come out and said booster. So I was discussing with her that would she go for the booster, and considering the side effects, she was hoping that she would look for a different vaccine maybe. So this is an internal discussion at home. I'm disclosing it just to be able to say, this is what how we are navigating. So because I believe in vaccines, in the benefit of the vaccines, because of that, if I am in a position to advise someone or to say to someone that, hey, take vaccine or not, I usually tell them, for example, my family members, I say, hey, you should consider taking vaccine. But I have always tried to control my opinion dispensing to others to say you must take a vaccine or you must not take a vaccine. I myself feel my own message to me is I must take a vaccine. Now, this results in people sending a lots of comments, and that is where the heat starts, where people take it as their own responsibility to then go and teach me a lesson. Other side as well. Whenever I talk about, let's say, ivermectin or others, they want to teach me a lesson that why, how dare I talk about ivermectin? So this is how much I can tell. Christine says, Dr. Bean is courageous. He doesn't cut and run. The price being taken is a lot. I actually did not think that this will be the price, but Sophie's Kingdom says monoclonal antibodies for exposure. Would the body still produce its own bodies? Can this treatment prevent illness? Thank you. So, very good question, and multiple parts of the answer. Number one, if somebody is exposed, and as I just discussed, that it is possible that they would just not even have a problem. And so we have seen that out of 100 people who get infected, really more than 81% are just asymptomatic. They just, or very mildly symptomatic. And then 19% are the one that become a little more severe. And then out of them, about 17% out this all, not out of these 19%, but about 17% of the whole end up in the hospital, and then about 3 to 5% end up in the ICU, and then about 3% die. So um, it is possible that many times person would just either not feel much or feel mild symptoms and become okay. Now, to your question that let's say somebody is exposed and monoclonals can be taken, I would prefer Regeneron, the polyclonal antibody. These are two monoclonal antibodies. When they're taken, Regeneron says it on their label that this may reduce your immune system's capability to mount a response to SARS-CoV-2 in the future. That doesn't mean that somehow monoclonal antibody damages our immune system to be not able to react to the SARS-CoV-2 in the future. But what happens is that in the presence of monoclonal antibodies, so let's say these are the antibodies circulating in our body, and they are saying, where is the SARS-CoV-2? And SARS-CoV-2 is standing there and saying, oh man, I am going to be, so he's doing the, I didn't draw very good of that. This is why I need artists to do this. So he's saying, oh, I'm going to be picked up by this monoclonal antibody. So the antibody is going to pick it up and cluster with it, make a complex. We call it antigen antibody complexes. When that complex is formed, the immune system doesn't get a lot of chance to look at this pathogen and develop a response because it is now coated by this monoclonal antibodies. So the immune system cell that is standing here, that is actually very, very much interested in seeing that what the heck is this pathogen. That immune system cell may not get good look at it. Because of that, immune system's training to produce antibodies and cytotoxic T cells may not be as robust because the viral load exposed to the immune system is less. This is why they say, hey, your future reaction may not be strong enough. I'm paraphrasing them. But if the person gets infected in the future, if they're healthy, they would mount a response. But I would prefer that nobody gets infected. That's just not the best outcome or best thing to do. So now going back to your question, monoclonal antibodies for exposure, yes, it's a good thing. Will we still produce antibodies? Yes, but less in number. So they don't say on the label that you will not be able to manage or respond to SARS-CoV-2 in the future. They say your ability will be reduced. And so that is possible. Now, it is possible that in some people who are, let's say, taking monoclonal antibodies because they have a risk factor, maybe they're immunocompromised, or maybe they're taking chemotherapy, or they're taking immunosuppressants, or they have multiple myeloma, as we discussed today. For such folks, monoclonal antibody is important to help them, but it is possible that they develop almost no response. So that means it's not one size fits all. There are so many dimensions of this. So Westfield says, since you're so talented in many areas, why not pivot to reviewing the latest Apple and tech gadgets? Less of a target and lots of dollars. I can do that. The question is, will you be there to watch those? Because I'm going to come in tomorrow and say, here is an iPhone and this looks good. And you're going to say, what the heck, Mobeen? Because I'll have to develop that skill. John, it seemed like this was a study that was reported in August. He did not provide me a link, but people just said, hey, this was the old August study. So Rima is a good question. Is it worth getting Regen on day 7, 8 if not getting improved? So here is the answer that is my opinion part. It is just my opinion. This is not a medical advice at all. I know that we have had Dr. Paul Merrick with us, and he has said many times that by 7th, 8th day, there is no more virus. And because of that, any antiviral type thing will not be useful. But we have seen in the studies that in some people, the virus hangs out. The outlier in one of the Chinese study that I discussed early on last year, the virus stayed in the person, healthy person, not compromised, for 29 days. We also know that immune system can start responding, and we are seeing that with the vaccines. Remember, dose 1, dose 2, and then 7 days after, and dose 1 is here and dose 2 is 21 days later, because they are hoping that by 21 days immune system has geared up. So it is not necessary that immune system within 7 days, it has to come up very fast. So let's say within 3 days comes up high enough that it can take care of the virus, and by 7th day it has destroyed it. So that means in some people, immune system may not have recovered the virus, or in some people, the virus load may be good enough, big enough, that immune system has to continue to fight for more time. We also know this, that there are many times people do PCRs or other tests. As much as PCR is not a sophisticated test to say we have live virus, PCR is really just going to tell you fragments of RNA present or not. That may be inviable virus. But still, many people have PCRs positive for many weeks. That means if somebody is in trouble and we are at day 7, 8th, 9th, it is, and we suspect they might become really bad and end up in a hospital or die because of their comorbidities, then trying Regeneron is not a bad thing. So again, not a medical advice, just my understanding of the mechanism. Julia says, since patients may not respond well to vaccines, what treatment prevention options are there for people with who also have kidney failure? What about IVM? So, of course, IVM, of course, molnupiravir, of course, other antivirals, of course, this, what is this, Regeneron, we were just talking about it. These are the drugs for such cases. I always say when my arm is hurting, I'll just take 10-15 minutes, then I keep going. Marco Lancion says, can someone who has simply been infected with COVID but did not develop the disease spread the virus? Yes. If so, how do vaccinated and unvaccinated spread compared to the infection pre-disease stage? So, first part, yes. And let's figure out, I'm going to keep this. Where did that question go? Here, sorry, go fake yourself. I would answer in a second. So I'm going to keep the question here. First part, can somebody who is asymptomatic, for example, or who did not develop symptoms, can they shed? So, yes, shedding simply means presence. So, let's say this is the tongue, this is the face. You know what I'm drawing, right? So, here is the eye and stuff. So, he looks blind. Okay, better, but everything is disproportionate. Please don't mind. So here we have nasal area and we have the mouth area. And let's say the person has pathogen here. If asymptomatic simply means that pathogen did not develop enough load, then whatever tiny bits are here can be shed out. So the question would then become, can that be shed in reasonable quantities? That may not be the reasonable quantity. Now, they could also be, if they are asymptomatic but still the load is higher here, can they shed? Maybe they were going to become symptomatic, that means load is increasing. Then the Chinese study that I discussed, that said 2 days before the symptoms. So if the symptoms start here, symptoms, then 2 days before the symptoms, the shedding can start. So that can happen. Now, if so, how vaccinated and unvaccinated spread compared to the infection pre-state disease? So, same thing. The basic difference between the two is that, let's say, and we are again going to talk about healthy people. There can be people who are vaccinated and not healthy enough, and they may still have a higher load and they may still shed. So we're talking about healthy people. In healthy individuals, or let's say younger, that means every age group may behave differently. Again, one size fits all is not the answer. But let's say in a younger individual, 30-year, 40-year, they are vaccinated. Their vaccine is just vaccinated. So now their system is active. In that case, they may not even shed at all. But let's say the system has gone down to a resting state and now the infection occurred. Then at least a couple of days before they develop enough of the response to take care of the pathogen, they may shed. Now, the unvaccinated or not previously infected would continue to shed till they have taken care of the virus. So in the beginning, they would shed for a longer time, so maybe 4 days, 5 days. And then as their body starts taking care of the virus, they would start reducing the shedding. So the takeaway should be, shedding is possible in all these cases. It depends upon the viral load, it depends upon the body state, it depends upon how fast the body recovers from the virus. And that would determine how much and how long the person would shed. So Lizzie is correct. Hit the like button, guys. Yes. So Judgment Care USA says question. I have heard that spike proteins in blood vessel walls damage circulation blood cells. Any truth to it? So Judgment USA, these are the questions that I am sure that when I respond, then I get beaten up, then the whole slew of issues start. So let me answer it in a more political way. You'll have to read between the lines now. The answer can be seen this way. If there is spike protein anywhere in the body and it can connect to the ACE2 receptor in sufficient quantities and it can stay there, then that cell may become more pro-inflammatory, or more, it may lean towards inflammatory state than anti-inflammatory state, because ACE2 helps with the anti-inflammatory. This cell may get attacked fast, it may become victim to inflammation fast, and the injury can start from here. Now, wherever this spike protein may be, that is where this can happen regardless of the full virus being present. This is just the spike protein's attachment to ACE2 can dysregulate cellular defenses. This is why some folks call it cytotoxic. Now the question is, can it be in the blood vessel? Can it attach to the ACE2 over there? Can it cause enough sufficient numbers to cause a damage? I would not discuss that part, because I've done that discussion in the past many times and gotten my share of beating. I am very candid about how things are. Texas Max says, I can hardly see the lines. Oh, by between the lines. Yes, Texas. I may have to go help Hina find the cats. So today, while I was teaching, the door stayed open and they both are out, and it's all pitch dark now. So, random, your question. So you're saying that my screen is out of focus. Let's see if I can. Which screen is me out of focus, or the am I out of focus, or this shared screen? If shared screen is out of focus, and that is simply a problem with the network. So let's take this as a last question, because my wife is figuring out outside where the cats are, and I should go and help her. Random says, hi, Dr. News about intravenous vaccination. So, Luffy, I can hear. Is that the main cause of myocarditis after vax? Also, show your drawing tablet model. So, once again, I'm going to leave the first part because I've done a very detailed discussion about it. And even to this date, I get lots of types of messages. I've done that discussion. It is present on YouTube. Now my tablet, this one is Cintiq 13 HD. I have a Huion as well, I believe 16. What was the name of it? Canvas 16 Pro. That is with the other computer. This one is Cintiq 13, Wacom Cintiq 13 HD. So thank you very much, everyone. Please, once again, like, subscribe, and share. More than ever, I need that nowadays. And it is free for you to like. And then if you would like to support this work, there are some links in the description. You can buy me a coffee or be a patron or use PayPal. Thank you very much. Stay safe and healthy. Keep yourself relaxed, keep others relaxed, and I'll see you tomorrow. Bye-bye.